Hi, beautiful people around the globe. Yes, welcome to my YouTube channel. Today we'll be talking about blood clots. What is blood clots? Let's get into the video and get to find out what blood clot is all about. So today we'll be talking about the signs, we're going to be talking about the symptoms and how to prevent blood clot. Let's get started already. Hello friends, my name is Dr. Buchi. You're welcome to my channel once again. I talk about medical issues, health-related academic topics and their likes. As you watch, please do consider to subscribe. I am here to talk about blood clot today and exactly what to do to prevent the occurrence. Blood clot includes deep vein thrombosis, DVT, which is the clot found in the legs, and pulmonary embolism, which is a clot found in the lungs. For the purpose of today's video, we'll refer to deep vein thrombosis as leg clot and pulmonary embolism as lung clot. The clots in the legs can either form in shallow or even deep veins, as the case may be, and if discovered earlier through health or medical check can be preventable and also treatable, and this is why regular health check is very necessary. Pulmonary embolism is clots that migrate from a particular area of the body, the legs especially, straight to the lungs. Patients can recover from lung clot if the clot is small though, as lung clot is a life-threatening circumstance. I need to address the risk, the symptoms, and the preventive measures of blood clot. In order to prevent blood clot, one must be able to know if one is at risk or not. Now, let's proceed to the risk factors of blood clots rather. If you have ever injured a vein that was brought about by broken bone or severe injury on the muscle, then you might be of risk to blood clots. Are you overweight? Then this is another risk factor, because too much weight is a big red flag. Do you expose yourself to sitting for so long, much or most especially sitting with a leg crossed, preventing the flow of blood? Is your job the kind of job that allows you to sit more longer hours? You need to learn how to stand and move around at intervals to prevent blood clots. Do you come from a family with a history of blood clots? This is a risk factor also. Confinement to the bed or wheelchair is not also left out. Smoking as well as vaping is also a risk factor. Are you age 58 or older than that? This is also a risk factor. A long period of living with diseases like heart conditions and lung dysfunction or diabetes too. These are risk factors. People living with cancer and undergoing cancer treatment could also be at risk of blood clots. Knee or hip replacement, severe trauma like accidents, etc. Hospitalization for surgery or some illnesses. Major surgeries, specifically abdominal, hip, knee or pelvis surgery. The use of hormone therapy that contain estrogen, and even the use of birth control formula that include pills, patch or ring. Symptoms of blood clots in the arm or leg, which is known as deep vein thrombosis or DVD, could be swelling, tenderness, as well as pain not caused by any form of injury. Discoloration of the skin that is too warm to touch can also be a symptom. The symptom of blood clot in the lung, also known as pulmonary embolism. Number one, irregular heartbeat, which is faster than it should be. Coughing up blood or intensified coughing when there is pain in the chest that occurs or gets worse when you take a deep breath or when you're lying down. Difficulty breathing too can also be a symptom. As soon as you notice or experience any of these signs and can relate with these risk factors, please get quick medical attention. Do you know that blood clot can be prevented and that safe treatment is also possible once you can identify the risk for blood clot and can figure out these signs and symptoms stated here? you should be able to talk to your doctor about what you feel at the time. If you can regularly maintain healthy weight, quit smoking, stand every 3 hours, and move at intervals when traveling a long distance or working long hours or driving far distances, also to stretch the legs. This enables the flow of blood and keeps you far away from having blood clots. To diagnose blood clots, special tests are required, and this can only be achieved by a medical team. As soon as you experience any of the symptoms and signs, please race quickly to the closest emergency unit for care. Learn to practice preventive measures, as prevention is better than being a victim of blood clot. Thanks for watching. Stay safe. Bye for now. Till we meet another time.